I'm Dr. Barry Eppley, plastic surgeon of Indianapolis, and I would like to share a few minutes and some thoughts with you on the very popular plastic surgery procedure known as liposuction. Liposuction has been around here in the United States now for almost 30 years and continues to be one of the most frequently done of all plastic surgery procedures. As I see and talk to patients about this procedure, I would like to share with you some basic considerations that you should know, as well as help correct some of the most common misunderstandings about liposuction. First and most importantly, liposuction is not for everyone. It is not a weight loss or weight reduction procedure. It originally was designed for spot reduction of problematic fat areas. That still remains where it is most successful and produces the best results. Over the past several decades, as it has become increasingly used, larger and larger amounts of fats have been removed. But the most successful result still comes from those patients who are at a reasonable body weight but still have those problematic areas that they can't quite get rid of. This is usually around areas such as the lower stomach area, the flanks or the back, the inner and outer thighs, and the knees. These continue to be the most successful areas where good results can be obtained. Secondly, liposuction can be done through a variety of different methods. One of the most common questions that I hear or get asked is, do you do tumescent liposuction? Quite frankly, almost all plastic surgeons in the United States do tumescent liposuction. Tumescence is a term that simply means the inflation or putting in a lot of fluid prior to actually doing the procedure in the operating room. The term tumesce means to inflate, or to inflate the areas of which are going to be treated with liposuction with fluid first. This achieves a variety of very important things, most particularly decreasing the amount of blood loss. And while technically there are different variations of the amount of fluid that's instilled, from wet to super wet to tumescence, I don't think you as a patient should be that concerned about that. Suffice it to say, everybody does some variation of tumescent liposuction. Nobody does it dry anymore for over 25 years. And so everybody does tumescence, and that is not an issue that you really have to concern yourself with. There are many new and different types of liposuction methods, and many improvements in liposuction have been sought over the years. These include such devices as ultrasonic, laser, and a variety of other methods of treatment. As we sit here today, traditional liposuction utilizing small cannulas continues to be the gold standard for liposuction. Certainly laser liposuction, smart lipo, vaser, ultrasonic liposuction, all have the potential in the right hands and for the right application to maybe offer some advantages over traditional liposuction. But there is no direct comparison or proven evidence that any of these newer methods are yet better than traditional liposuction if it is done well by an experienced plastic surgeon. So I would not get too hung up on the method that liposuction is done by. I would get very focused on who is doing it, what is their experience, and what feelings do you get with them as you meet with them in a consultation. The surgeon still remains the most important variable in liposuction as opposed to any type of device or machine. Lastly, a very important question that many people ask, and a good one, is how long does liposuction last? There is really no good answer for any particular patient. I have heard all sorts of comments from patients such that they've heard it'll come back to where it was removed. It won't come back to the areas where it was removed. It'll go to other new areas. And quite frankly, none of that is really particularly well known. As it relates to you, I think there's one statement that probably is valid, and this is what I tell most patients, is if your weight remains stable with good diet and exercise, your liposuction result is going to be fairly long-term. The most important variable is whether you gain weight or not over time. Hopefully these comments on liposuction are helpful to you and should prepare you as you go into your consultation with your plastic surgeon. I wish you the best on your liposuction experiences. I'm Dr. Eppley of Indianapolis.